Facelift for sagging face? I am only 34, but my face is already sagging. I have jowls and a slight double chin. It is a family trait, not a weight issue. I am 5'3" and 115 pounds. What kind of lift do I need? Short? S lift?
Thank you for your question. You're 34 years old and you state that you are not overweight, you weigh 115 pounds, but you feel like you have sagging and jowls and a double chin. And you state that it's a family trait and you want to know what kind of facelift you should have. Well, I certainly can guide you based on my experience as a cosmetic surgeon as to how I would approach someone like yourself in our practice. A little bit about my background. I'm a board-certified cosmetic surgeon certified by the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic surgeon through the American Society of Ophthalmic, Plastic, and Reconstructive Surgery. I've been practicing in Manhattan, Long Island for over 20 years, and facial aging is one of the areas that I have focused a lot in my practice. In fact, I wrote a book several years ago to help people understand better how to approach facial aging. So when it comes to facelifts, it's very important to make a determination as to whether or not you're a candidate based on the degree of laxity. You see, facial aging is two things. It's volumetric loss or loss of bone, muscle, and fat, soft tissue, and descent or sagging, loosening of the structure under the skin called the SMAS, superficial musculoaponeurotic system, the platysma muscle, and the skin and soft tissue overlying it. Now, in my practice of over 20 years, the youngest patient I ever did a facelift for was 37 years old. But it was a different situation. This woman who happened to be a physician, had very thin skin, and really did have laxity. And so a limited lift did help improve that area. In your situation, I would say that you are probably not a good candidate for a facelift. When you look at your profile, and in your front view, yes, it could be, we can say that there is some volumetric loss or there's some accentuation of the nasolabial fold, or sometimes referred to as the marionette lines. And at the same time, looking at the side view, you can see maybe a rounding, relative roundness, but certainly not a loss of the definition of the jawline. When we do facelifts, we're doing this to improve the neck, to improve the definition of the jawline, to lift the sagging cheek. Now, something to consider, and it's very important you do this strategically, is something that we call structural volumizing. Now there's a difference between structural volumizing versus the use of traditional dermal fillers, such as hyaluronic acid fillers, because I think you might find yourself frustrated by going to people who are trying to keep adding volume in areas in a way that's more superficial. So let me just make that distinction. We perform a procedure in our practice called the Y lift. And although I'm not suggesting that this is right for you, to describe what we do will probably help you understand how this method may be of value, although you probably won't need the kind of volume that we typically do with someone with more advanced aging changes. With Y lift, what we're doing is we're adding filler at a deeper level, at the structural level of the bone, and using these fillers in a very specific method to create definition of a jawline, definition of the entire mandible or the jawbone, a definition of the cheeks, definition of the chin. And so there can be an application of this method potentially for your situation. Again, one can also argue that you may be being overcritical and accepting that this may be just a genetic family trait and not focusing on it is also reasonable. There's plenty of time to consider facial aging interventions as you approach your 40s. During the 40s, this is when people really do a lot of the correction with volume and fillers, etc. But as an option for yourself, I would say structural volumizing may have a role. Now, in order to find a person who does Y-lift, we're part of a network of Y-lift trained providers, and it's a very distinctive method that is different from traditional use of fillers such as Juvederm, Voluma, etc., and that's routinely performed by a lot of different doctors. Now, there may be a value to a combination of the two methods also. But I think the take-home message for you is you are not ready, in my opinion, based on your photos, for a facelift. So think structural volumizing rather than lifting. So I hope that was helpful. I wish you the best of luck. And thank you for your question.